Hey, Dr. C here with you. So can you quit taking thyroid medication? The term is actually deprescribing. And I've been really surprised to learn about this. So I talked about how in the Thyroid Reset Diet, many people who are not yet on medication could have normal thyroid function. Those who are on medication can improve as well, but the biggest studies were done on those who are not yet on treatment, and most of those could get better. But what about those already on medication? Sure, there may be steps that one could take that could help. Maybe their thyroid could improve. But what if they just never needed them to begin with? Or what if the problem that they had of their thyroid function that made them start on treatment, what if that was just no longer there? What if they only temporarily had a slowdown and they were on meds longer than they needed to be? A lot of researchers have asked that same question. And the composite data suggests that about 30 to 45% of people on thyroid medication don't need to be on them. So this is a big thing. Thyroid medication doesn't always help people feel better. It doesn't always make them healthier. And it's a hassle to go get tested, to have to follow up, to pick these things up, to always be thinking about the dose being right or wrong. And then those who don't need treatment where it's too much, that can be dangerous. They can have excessive amounts, and there can be side effects from a hyperthyroid dose. So this concept is being taken seriously, and it's called deprescribing. We think a lot about in the world of medicine about prescribing, about starting treatments for helping conditions. But what about when the treatments are no longer needed? How do you back out of that process? And that's what deprescribing is all about. There's a quote that I really loved. We're defining it as the thoughtful and systematic process of identifying problematic medications and either reducing the dose or stopping the medicines in a manner that is safe, effective, and helps patients maximize their wellness and goals of care. So this is going to be all about deprescribing. You'll get a sense on who can stop and what process is best for doing that. Now, before we get any further, forgive me for being Captain Obvious, but this does not mean you should just throw away your pills and quit taking them tomorrow, right? Scout's honor, you heard me, and you're not going to try that, okay? So there are those who don't need it. We'll make sense of that, but it's not something just to embark upon in a rash fashion without your doctor's advice. So let's talk about this. Thyroid hormones are prescribed for many that don't need them long term. About 34% of adults on thyroid medication can stop them without developing abnormal thyroid levels. Some generalizations: those who are most likely to be able to stop are those who've been on them for less than 4 years. They did not have low T4 levels initially. They're on lower doses of medication and currently have TSH levels somewhere under 1.8. So those are the big categories that predict who likely can stop and who can't. So who should definitely not stop? Well, anybody who's just winging it. Someone who doesn't have their doctor's support or blessing. Those who do not have a thyroid. Women who are pregnant or nursing. Those are not situations in which you want to go through the whole deprescribing process. Now, as I talk through the studies, they're going to use these terms hypothyroidism and subclinical hypothyroidism. And they make some big distinctions on who's most likely to be able to quit. And there's also a term called euthyroidism, euthyroidism. I want those terms really clear because if they're not, what I say may not make perfect sense. So hypothyroidism, in this context, we're talking about a high TH, a high TSH, plus a low T4, or low free T4, either one. It's a diagnosis based solely on blood levels. Now, that's not me saying that that's only who needs thyroid treatment or only who has thyroid problems. I'm not saying that. I'm saying this bucket. That's how in this research they define that bucket. So we're clear on that. Another bucket is subclinical hypothyroidism. And this is funny because a lot of doctors in natural medicine use this word backwards. They use it to describe people who don't feel well but have normal labs. And it's pretty much the opposite. It's basically people that have partially abnormal labs and they may or may not have symptoms. So the details are subclinical hypothyroidism includes those who have elevations of TSH, but normal levels of T4 or free T4. And some will have symptoms, about 2/3 can have symptoms, a third will not, but symptoms are not part of this diagnosis. It's really just high TSH, normal T4. that's subclinical hypothyroidism. And the last one is euthyroid. So hypo, hyper, and EU. So you, think of that like equal. And that just means that it's in a good range. So euthyroidism means normal thyroid levels. So the first thing I want to talk about is a big study that came out February 2020. Now, this was a meta-analysis. What that means is it was a study of studies. They pulled together a large number of studies. They started with a large group of actually 2,600 possible studies and whittled those down to 17 that were of the highest quality. And when they synthesized all those together, that's where that 34% number came from. They found that 34% of people, as a conglomerate from those studies, could stay stable, euthyroid levels, no obvious symptoms, when they stopped their medication in a deliberate fashion. So that was a big thing. These studies were done in different ways. Some were on T4 only, some were on T4 and T3, so like Synthroid and Cytomel. Some were on natural desiccated thyroid. And there wasn't really like one process they went through. There wasn't a consistent taper process. Some would do it faster than others, some did it more slowly. Some generalizations though, some stopped over the course of 2 weeks. They would first cut their dose in half and then do that for the first week and discontinue after week 2. That was the most dramatic and abrupt. Others would go by half every 4 weeks until they were less than 12.5 micrograms. Some just did half and then cut the rest after 2 months, and some went down by 25 micrograms each step. So those are the different ways that they changed that. And what they saw was that those who were most likely to stay stable were adults, and they actually had a positive history of thyroid disease. And at diagnosis, their TSH was less than 10. So that was a big difference. They saw that thyroid antibodies, if they were extremely high, along with abnormalities and signs of tissue loss on ultrasound, those made someone less likely to have long-term effects of staying stable. And there's an algorithm from this study that I'm going to show. So this explains the process that people went through. They were first selected to see if they were good candidates. Their medications were reviewed. They had a conversation about deprescribing, which they were warned about the possible drawbacks of that, such as you may not feel well, your levels may not be stable, this may not be right for you, and you may have to go back on treatment. It may take more adjustments because of it. And those who felt that it was worth those drawbacks proceeded with a plan, and they were monitored. And that's where they saw is about 34% did fine of the conglomerate of these studies. Now, that one was done of studies prior to that time point. Soon after that came out in February, in May of 2020, there was a large trial done on deprescribing. And because this trial was ongoing while the meta-analysis was taking place, this one was not included in that meta-analysis, but this was relevant. Other researchers, Dr. Jung and others, they put together a paper about clinical factors predicting the successful discontinuation of hormone replacement therapy in patients diagnosed with primary hypothyroidism. So basically, who could get better and who couldn't. They looked at records for 382 patients who'd been on treatment for at least a year and were then able to come off of that. And of them, what they saw was that how long they were on treatment, what their TSH scores were before stopping, and their medication dosage were the biggest predictors. Something that was kind of cool about this study is that they also gave recommendations for avoiding high iodine intake, and that turned out to be an important variable. And I've said before that we know that iodine reduction alone may help many restore their thyroid function. In fact, studies have shown that might work 78% of the time. So in this study, they didn't go into great depth about all the possible sources of that, but they did encourage cutting out some obvious high iodine foods to help people do better. And I'm going to share an image here, which was a decision tree that came out of the results from this study. So yeah, those that had disease for more than 4.6 years were less likely to get better, as were those who were on higher doses. So of those who had disease for longer, like more than 4.6 years, for them, their medication dose was the biggest predictor on whether or not they could stop medication. So those on more than about 56 micrograms of T4, or about a half a grain of natural thyroid, not as many could. There was 6% success. The opposite end of that, those that had been on treatment for less than 4.6 years, for them, then the TSH score was the biggest predictor. And like the last group of studies that I mentioned, 1.8 was that marker that made the difference. So if their scores were less than 1.8, then they had a success rate of 44%. So they were much more likely to be able to successfully come off of treatment. And we look too at symptoms. So of those who are able to successfully come off, they really could do just as well on their symptom control. There were those to where symptoms did not improve, but they didn't end up in that 34% number. So if you're thinking about this, if this applies to you or not, here's the biggest steps that I would encourage, and here's a process for that. So first off is really reduce iodine. And again, the researchers in the Jung study, that was the one recommendation they gave. They said that patients were recommended to restrict the intake of high iodine foods. And they recognized that iodine was one of the biggest drivers of thyroid disease. And to do that, that's the whole Thyroid Reset Diet. Eat green light foods, learn about hidden iodine in your cosmetics. It's a big driver. Learn about iodine in your supplements, be aware of it in any medications, use iodine-free salt. And these are all things that the book gives you in great detail on how to do. And then eat the green light foods, and you'll be on a very well-regulated iodine plan. So that's the first step. Now, what they also saw from this study was the TSH was a big factor. So going into it, you'd want to make sure that your TSH levels are relevant. You wouldn't want them too high, or you'd be less likely to be successful. And lowering iodine can be a factor for helping the TSH. It can also help lower your thyroid peroxidase antibodies. And those have been shown to be large factors predicting your success in deprescribing. So yeah, multiple benefits for iodine regulation. Next up I think about is micronutrient sufficiency. So make sure that you're not lacking in selenium, zinc, vitamin D, magnesium. These things all really collaborate and they're needed together. I made the Daily Reset Pack. You want something like that, a thyroid-specific multivitamin, and that'll cover your bases for your micronutrients. So to wrap all this up, think about who could this be applicable for. So it's not for those that lack a thyroid, those who are pregnant or lactating, or those that need really high doses and they've been on treatment for many, many years. They're less likely to be successful at this. It's most likely to help those who've been on treatment for 4 or 5 years or less, those who are on lower doses of medication, those who have TSH scores of 1.8 or under. And here's the cool thing, women did better than men. And there's so many ways in which thyroid disease, autoimmune disease, a lot of things strike women worse than men. But for deprescribing, women seem to do better than men. So that's a cool difference. So how would that taper process work? Well, again, I would encourage someone on the Thyroid Reset Diet to also be on a thyroid-specific multi, work with your doctor, and thinking through these studies and just my clinical experience, here's how I would play that out. So the first 2 months, do the thyroid multi, do the reset diet. Just do those 2 things. Don't try to push the envelope at all. Starting the 3rd month, assuming your levels are stable, working with your doctor, let's say that someone, as an example, is on a 100 microgram dose of Synthroid. So they could reduce by 50 micrograms for that 3rd month. So 3rd month and 4th month and 5th month, stay with that and then recheck progress with the prescriber. After that point, they could go down another 25 micrograms for the following 2 months and follow up with the prescriber as well. From there, they're on 25 remaining. They could just, if they're stable, that could be stopped with the provider's guidance. But that's a suggested taper process over a 6-month total time frame. So yeah, deprescribing, there are those that are on treatment that do not need it. And here's what we know about that, and here's some things that can make that work even better. All right, Dr. C with you. Take great care. Bye-bye.